Got it?
Uh-huh. So it's through this.
So this is kind of honestly standard operating procedure for anyone who is getting admitted. Almost always they're going to put you on an side. A medicine back in the day, we would do aspirin a day or something, and they still do that. Some people still do the aspirin, but in the hospital, generally, most hospitals I've ever worked in, they'll do a enoxaparin shot daily. This will be your first one. The fancy word that they use for it is like venous thromboembolism prophylaxis.
Ooh.
So the idea is like, especially when we're in the hospital, we're going to be lying down maybe more, sedentary more. Our blood isn't returning as well as when we're moving and we're active.
Right.
So you have a higher risk of forming venous thrombi, which is a clot in our venous circulatory section. But and then prophylaxis is the fancy word of saying to keep it from happening.
Right.
So you might see people or know people who've been in the hospital and they put them on those stockings that
Oh
compress.
yes, I've done the operation.
Yeah, it's the same thing, but it's just a medicine
Okay.
that helps attack that same problem.
Yeah.
Sorry. So if you've never had them before, or have you ever had insulin shots?
No.
These aren't like vaccines or anything. They go in the subcutaneous tissue, the fatty tissue,
Yeah.
not in the muscle.
So you're not gonna give it through this. Oh,
But it's a tiny, tiny little needle, and usually people do it in the back of their arm or on their stomach, and you just kind of like pinch and put in this tiny, tiny little needle. It goes in. There's actually a bubble at the end. You'll hear it like when I finish pushing the plunger, and that is almost like a Band-Aid. Like it holds the bubble, holds the medicine in the arm. Isn't that wild?
So how much of that do we need to get?
It's the standard doses for an adult, 40 units
a day.
a day.
Hello.
Hi.
How are you, sir?
Okay.
I'm Dr. Martorell, one of the doctors with the medicine team.
I'm just about to give him a shot. Do you want it in your arm or your stomach?
Yeah.
In the arm. Okay, thank you. Sorry.
No, you're good. I'll be the one that's going to be admitting you to the hospital.
Okay.
So tell me what's going on. What brought you in the other day? And I know what brings you back, but what happened when you came the other
I was
day?
just working and I just felt tired and then I rested. I was on my back and then I said, let me rest and start again. Then I started work again and then I just felt tired again. And then
Okay. And this was how long ago?
on Wednesday.
Wednesday? So you
ready?
Yeah.
So you just felt tired?
Yeah.
Okay. Any other symptoms?
Just faintish and nauseated a little bit.
Okay.
And but I couldn't move. I mean, I could, but I was conscious. I
So
could
did you
move my legs.
Did you fall or no?
No, I was on my back
No
already.
fall. Okay. You were on your back already?
Mm-hmm.
What do you do for work?
I retired.
Okay.
Yeah, but I was just doing some work at home.
Okay.
Just make sure you're doing okay. And
Yeah.
do you need anything else?
Well, I mean, they said you can't get food here, so one of the nurses gave me
I
a
don't know
sandwich.
if he's.
He can eat.
He
Yeah.
can eat?
Yeah.
I can look for some snacks for you. Okay.
Okay.
I'll be right back.
All right. And
So you were laying down already?
yes, so you're doing plumbing.
I
at
see.
home and-
I see. Okay. Has this ever happened before in the past?
Similar. So I laid there and thought it was syncope because I have syncope.
You do?
Yeah.
Okay. So you fall often?
Not really fall. And when it's coming on, I know what to do. I lay down and lay on my back and keep as cool as possible.
You feel like you get tunnel vision? Is that how you can tell you're about to?
Just no, you feel weak in the body.
Okay.
And you feel like something is draining from you.
Okay.
So
Have you been
Okay.
worked up for this in the past by a doctor?
My primary doctor, we are aware of it, so I've been to the hospital, but I don't remember if we ever got work up anything for it.
I see.
Yeah.
Okay.
So it's when you already know the blood. When I'm flying, sometime my blood pressure drops. Well, that's what we found out. When it comes down, the blood pressure is way low.
Drop.
Mhm.
Okay.
Yeah.
Is it mainly when you go from like a sitting to standing position, or?
Surprisingly, sometimes when I'm rested,
When you're
I've
resting.
rested, or when I find out when I drink tea,
I see.
then I would work, then come home and drink tea like an old Englishman and think
I
it was
see.
something.
Okay.
But what my doctor told me it was dehydrating.
Okay.
So it's when the water
Yeah.
dehydration is low, and I'm too hot.
You get hot.
If I'm too hot, not really get hot.
Thank you.
Thank you.
Are you in pain anywhere when this happens?
No, you just have strange, weak, nauseated, uncontrolled feeling.
Okay. Do you take any medications on a daily basis?
Yeah, the pressure tablets in the morning and the cholesterol tablets in the evening.
Do you know what blood pressure medications you're on?
Yeah, my blood pressure is the amoxicillin,
Amlodipine?
amlodipine, and the losartan,
Okay.
and it's losartan is 100 milligram, and the amlodipine is 5,
Okay.
and the astravastin is 40 milligram.
Okay. Is your blood pressure normally well controlled at home?
Well, I take the medication, but I haven't had it. I didn't bring it with me because I was expecting to.
I see.
My wife told me they would probably give it to me here.
Yes, I'll make sure you get that now, actually.
Yeah.
When's the last time you took your medicine?
Yesterday I got the full dosage, both,
I see. Okay.
and then I take a vitamin
Okay.
D2 once a week.
It's 5 milligrams amlodipine.
Yeah.
Any leg swelling?
Left leg.
Is that normal?
What has it? Not swell big, but you can feel weakness in the leg,
Any pain?
pain in the hip. So I'm not sure if it's coming from the hip.
When did this start?
Maybe about 3 years ago.
The leg swelling?
Slight leg swelling, yeah.
3 years ago? Have you ever had blood clots?
No,
Any family members with blood clots?
no,
Any smoking
no.
in the past?
Play when we were a child.
Okay.
8-year-old,
Okay.
10-year-old.
So no tobacco products. Any other recreational drugs?
No.
Any alcohol?
Yeah, no, and then like cognac, so
How often do you drink?
maybe once every 2 weeks or something.
Okay, so rare. Okay. Any family members with history of heart attack, stroke?
My mother had stroke, but she passed. Yeah, she had stroke.
She had stroke?
Serious stroke. But she
Okay.
passed.
Any family members with like sudden death?
No.
Okay. Do you take your blood pressure at home?
Yeah.
And what is it at home, typically?
So 150 something over 80 something.
150 over 80
Or 140
something.
something. Went after the medication. Yeah.
It's still 140 after the meds?
Sometimes 140. over.
Okay.
But it can be high but I don't take medication.
Okay. And let's see. Any chest pain?
No,
Shortness of breath?
no,
Any chest pain or shortness of breath when you're doing activities?
no pain, but I find that I get tired easy.
Okay. Have you ever had like a stress test before for your heart?
Yes.
When was that?
Wow, I don't remember when, but I've had them over the years. It's been construction in the old days.
And have they been normal?
Sorry, I don't know.
That's
Yeah, I think they came because we thought it was heart related, but it was more or less muscle strain.
muscle strain. So the stress tests have been normal.
Yeah.
Okay. Alrighty. Have you ever seen a cardiologist? Do you know if they've ever done an ultrasound of the
I
heart?
think so, but I can't find it in my records. I keep a record, and
Okay.
I've done the when you put the solution and
I
run
see.
the thing over here.
Okay.
Or it might have been. Well, I think so, but I
Yeah.
don't see it in my records.
Any fevers, chills,
No,
abdominal pain,
no,
diarrhea,
no.
nausea, vomiting?
Only when I felt like not
Prior.
vomiting.
Just some nausea.
Yeah.
No.
You mean now? You mean now?
Yeah.
No.
None now.
Oh.
That was just before earlier. You felt that. Any headaches?
I've been having a slight headache for about 2 weeks. I talked to my doctor because I just went to the doctor last week.
Okay. I see. And what did they say about the headache?
She didn't think it's anything serious.
Any vision changes?
No.
So when they checked some of the labs you had done yesterday, they saw one of the heart markers was high.
Mm-hmm.
Have you ever been told that's been high in the past?
No.
At troponin? Okay. Any recent illness or cough, cold, congestion, sore throat?
Nothing extraordinary.
Okay. So no cough.
Because I take vitamin C's to
And
keep
you
that
take-
away.
Okay. And aspirin you take?
Whenever I feel a little bit weakish, I take an aspirin and I feel like it.
Like a baby aspirin?
Yeah. I feel revived.
Okay. I see.
Well, this is the well, not the second day, but I'm still in the emergency room setting. This is Shippy the Explorer. We probably listened to some of the conversation with the doctors and the nurses that have come in. I didn't want to video them, so we just did audio, and don't know how much of that will be put out. But this is Shippy the Explorer, just exploring the whole experience of being in an emergency room. This is Saturday, and and this is Saturday, just close to 1 o'clock, and we have been here in the front part of the emergency from 6:30 yesterday, and now about 4 something this morning, finally came into the inner part of the emergency. So I've seen 2 main doctors, resident emergency room doctors since morning, and a series of nurses, and they have done a number of blood tests. Still feeling well, still complaining that we haven't had anything to eat, but I got that sandwich and then the ham sandwich, and clean that up, and then another doctor or nurse brought me this it's like a fruit bar, Newton's real fruit. Turn it this way, see if it comes out. Oh, it's still not coming out right, so it's a reverse camera. But anyway, I have this to go munch on, so this is looking forward to something in an emergency. So what do you do when you're in an emergency room? You don't have anybody to talk to, really. I get a couple of calls, and now the TV, the TV to look at, and that's about it. Didn't bring any books. Don't have any main book I'm reading right now, so that's I'm actually writing. Well, I'm finished writing. My editor is putting 3 fathers in the life of a child. That is the final production is coming out, and the other book is Going Down Under. Both of them by Laurel Morrison. So at this rate, maybe I just promote the books and see when they come out. They're going to be I think they're on Amazon right now, because I'm trying to get copies so that I can distribute to certain key people, certain libraries, and that's where we are. So when you're in an emergency center, and especially if you're not feeling too well, then your mind also wanders and all sort of things. And you don't have the computer gadget to play with. So I do have my computer. The telephone is almost like a computer. I was surprised that I was able to release that small video on just the iPhone. So I might just do that for the next couple of days. I'm expected to be here until Monday, I think. Don't know how we'll make that, but might just toughen it up and get that, because they're gonna do a special test on, and it's only done on the weekday. So in the middle of not really bored, but sleep and get up and watch TV and do video and eat a snack. That's the most we can do. Good. Well, don't forget the bathroom. All right, but surprisingly, still doing well. We're just trying to determine what is the cause of the troponin. That's the enzyme, increase of enzyme in the blood whenever you have a heart problem. So we're teaching you something as we go along. That's teaching myself and also educating others of what that means. If you see elevated troponin in your blood system, if you ever go to the doctor, that means you might have had a heart-related damage or heart attack, or you might have had a flu or something that affected the heart. But mostly it's a little bit of heart damage. So, but if you do a tremendous of love of yourself and others, then the heart will heal itself, folks. So don't worry about it too much. Just go with the flow. So as we explore together to see what the cause of elevated troponin, then we'll deal with that. So, all right. So bye for now. This is Shippy the Explorer. We'll now the doctor and nurse is here to visit. So see you soon. Well, we have added EKG to the mix. As these are the wires. Oh, see, like one of the wires is popped off. Anyway, so EKG's added to the test, and in the room you have the monitor cuff is permanently on your arm, and now they have added, because the doctor wants to have the EKG machine running, and those are added to the mix. They want to see a constant reading, periodical reading of. So we are in room M4307A, and on the 2 blankets, a 2 bottle of water, and Sonia and Tyra and Lacey was kind in letting me settle in, and here we are. Oops. And now I'm in the room, and it's quite comfortable, and with the television and all of that. So they gave me a couple bags to put my personal stuff in, and just order food from the kitchen. The guys recognize me already. Kitchen number is 46424, and wow, ready to sleep. But since I was starving from downstairs, I'm gonna try a snack before I go to bed. Being observed with a monitor on my chest here. So that's it. It's quite a marked difference from downstairs. 1 minute you're starving, next minute you have all the treatment in the world and kindness. So thanks to the guys. Should be a better night. See you. So you see me smiling? Okay. It's because I've just ordered a quesadilla. Let's see what we can get the light bright so we can and so this is the snack for the night. Quesadilla. Wow. And the ginger ale. Light sour cream, carbohydrate 1.2%. There we go. Chicken. Another quesadilla, I think. Light sour cream, carbohydrate, shredded cheese. Can't even find the name. Anyway, that's the snack for the night, and from one extreme to the next. Here we are. Once was hungry, now we're fit. So we'll finish up the night. This is turning out to be okay. We'll finish up the night and have a snack, have a drink, brush my teeth, and go to sleep. Maybe do some work. But this is Shippy the Explorer saying, I'm okay, doing well, and just here for the observation tonight, and we see where we go from there. So be good to yourself and others, and everything else will be all right. So good night, good morning, good evening. Be well. Blessings. See you.